There's a group of medications originally designed for diabetes that we now use to protect the heart, slow down kidney disease, and in some cases help people live longer. These medications are called SGLT2 inhibitors and have rather complicated names like dapagliflozin, canagliflozin and empagliflozin. As you'll note, all of them end in flozin, so they're often called flozins. If you've been advised to start one of these, or you're wondering whether you should, this video will explain exactly what they do, who they're for, and most importantly, how to take them safely. I'm Dr David Stokes, I'm a GP in Sussex, and today I want to explain in plain English how these drugs work and whether they might be right for you. So what do they do? These medications work through the kidneys. Normally your kidneys filter glucose out of the blood and then reabsorb it back into the body so it's not wasted. These SGLT2 inhibitors block that reabsorption so that instead of bringing it back into the body, it's passed out into your urine. In simple terms, they help your body get rid of excess sugar. So why are they important? Well, what's really changed over the past few years is how we think about these drugs. They are no longer just diabetes medications. We now use them because they lower blood sugar, help with modest weight loss, reduce blood pressure, and significantly reduce the risk of heart failure, as well as the symptoms of heart failure in those who've already developed it. And importantly, they protect kidney function. So increasingly, we prescribe them not just for glucose control, but for long-term organ protection. Who are they for? Well, you may be offered one of these medications if you've got type 2 diabetes, particularly if there's some cardiovascular risk associated with it, if you've got chronic kidney disease, or if you've got heart failure, even if you don't have diabetes. And this is the important shift. Sometimes blood sugar is not the main reason we're giving this medication to you. It's like all medications, there are some side effects to be aware of. The most common of these are related to the fact that you're passing more sugar out in your urine. So it increases the risk of genital thrush in both men and women. It increases the risk of urinary tract infections, and it can mean that you pass urine more frequently. These are usually all manageable, and there are some things that I'm going to tell you about later that might reduce the risk of them, but it's important to recognise them early and seek help. There are a couple of very important risks which you should also be aware of, although you shouldn't be alarmed as they are very, very rare. By knowing what to look out for, you can seek help early if you develop any of these worrying symptoms. Dehydration is a risk, particularly if you're not drinking enough or if you're unwell. A drop in your blood pressure could make you feel woozy, particularly if you're a little bit older, and that needs to be managed carefully so you don't fall and injure yourself. A rare but important condition is called diabetic ketoacidosis, which can occasionally occur even when blood sugars aren't particularly high. If you were to develop any symptoms of this, namely nausea, vomiting, abdominal pain, fatigue, rapid breathing, or confusion, you should seek urgent medical attention immediately. It is uncommon, but it's one of the reasons we give clear safety advice around these medications. The final important but rare risk is a complication called Fournier's gangrene, which is a severe infection of the skin and tissues around the genitals. As I say, this is exceptionally rare. However, anyone on one of these medications who develops symptoms such as hot, red, inflamed skin around that genital area should seek urgent, immediate medical help to get that looked at straight away. So some tips to stay well while you're taking these medications. Something called sick day rules. These are a set of medications that we give which you should stop temporarily if you become unwell with, for example, diarrhoea or vomiting from any other reason. If you do develop vomiting, diarrhoea or fever and you're not eating or drinking normally, then you should pause these medications. I'll put a link in the notes below that you could look at other medications which are important to stop if you were to develop any diarrhoea or vomiting. Once you're well again and eating normally, you can usually restart the medication. But if in doubt, it's always best to check. Some other practical tips that can make a big difference to whether you get some of the more minor side effects. Take the medication in the morning. This means that if you're having to use the loo more frequently, it's not getting you up. Make sure you stay well hydrated. Try and make sure that you keep really good personal hygiene. This can reduce, particularly in the genital area, this can reduce the risk of thrush developing. And seek medical advice if you develop any of those symptoms, such as the nausea, abdominal pain, or unusual fatigue. For the right person, SGLT2 inhibitors can be genuinely transformative. They're one of the most important developments that we've had in these areas of medicine in recent years. But like all treatments, they need to be used thoughtfully and with a clear understanding of both the benefits and the risks. If you've been advised to take one and you're still unsure having watched this video, make sure you have a proper discussion with your clinical team so that you can make a decision that's right for you. I hope you found this explanation of these important medications informative, and if you still have questions, drop them into the comments below and I'll look at whether we could perhaps make a further video to answer any of those. Many thanks for your time. Take care.